Good evening. I tried to do this from my laptop, but was unsuccessful. My name is Jo, and I'm from Equine Therapies WA, and I thought I would do a talk on what is normal for your horse. I've had a number of clients that when I've asked questions, what's this scar from, what's this groove, what's this lump, they were unaware that the horse had these issues. So one of them was a groove in the pectoral muscle, which ended up being a torn muscle. So I thought I would just do a bit of a talk on what is normal. When I palpate the horse, I'm looking for four things: temperature, texture, tenderness, and tension. Now, each of these things represent certain things about your horse. When you're feeling your horse, is there any warmer areas than others? Are there any cooler areas than others? Heat tends to indicate inflammation, where cool areas tend to be a circulation issue, but that is for the vet to determine. Texture, we are looking for the elasticity of the skin and the muscle fibres. Are there any areas that are quite soft, any areas that are too hard or lumpy or feel stringy? Tenderness, check how the animal responds when you're touching, rubbing certain areas of the body. And texture could be from stress, scar tissue. If there's any area that's tight, generally means there's less circulation getting there and will limit your range of movement. So I thought I would just do a general talk about what is normal. Do you know what is normal for your horse? When you're getting ready to ride, you're saddling up, or whether you're rugging, whether you're grooming, always run your hands over the horse's body so that you know yourself what is normal. It'll help you as the horse owner, and it will also help your horse greatly. I'm doing a different post each day of this week in regards to what is normal for your horse. Do you know what your horse's respiratory rate is? That's watching your horse stand away from him and just watch him or her breathe in and out towards the end of the ribs, and just count their breaths per minute. Normal is 8 to 14. Anything higher than 14 possibly can indicate a pain. There's pain somewhere. That is for you and your vet to determine. So I've just got a couple of notes here, so I'll just put my glasses on to check. Heart rate. Do you know what your normal heart rate is? Most horses are between 32 and 44, and these things help help the vet determine how if your horse is a priority to be attended to, or whether they'll give you some tips to do in the meantime till they get there. So if you know what's normal, these signs are very important for the vet. Temperature, which you would take by inserting a digital thermometer into the rectum of the horse. Do you know what your horse's normal temperature is? Which is 37 to 38.5. Anything higher than that could indicate a fever, bacteria or virus. So these are all important. the oral mucous membrane, which is under the horse's top lip, if you just push and hold it there for a couple of, 3 or 4 seconds, then remove your finger away, how long does it take for that colour to come back to that spot, which is normally 0 to 2 seconds. Anything greater than that, 3 or more, like over 3, can indicate blood pressure is low, or it's not coming back quick enough to that area. Gut sounds are also important. Do you know what your gut sounds on your horse sound like? And there's 4 quadrants that you need to listen to get this information from. And I will just show you a little photo so that you know where upper and lower on both sides of the horse to listen to this. Down in the comments below this, I will have a link to my website, and if you go to resources, you can get a sheet like this, and it'll have the date and time, and each column is for the temperature, the heart rate, your gut sounds, that you can download and do it for 5 or 6 days. Then you'll be able to work out an average. So when anything does happen to your horse and you ring the vet, they will generally ask you for these, and this helps them determine whether, because we all love our horses and we always want the vet to come now because it is an emergency, but is it an emergency as far as the vet goes? So knowing this, these figures helps the vet to determine if your horse is really, really serious, or whether he can see the horse in the next hour or 2 or 3, depending on their workload. So each day I'll be doing a post on each of the temperature, the heart rate, the oral mucous membrane. So watch out for that this week. And I'm quite nervous. I'm going to finish this talk this evening. Each Monday night at 7 o'clock I will be doing a talk, and it'll be different topics. So if you've got any questions or comments, feel free to put them in below. Next week I will be talking about photonic therapy, red light. Each Monday at 7, as I said, there'll be a different topic for that particular week. So please give me some feedback. This is my first live, and I don't like doing lives. But yeah, so have a good night, and I will see you next Monday night.